Okay, so today I will be doing my theory application for Education 181. So before we start, who am I? My name is Madison Ard, and I am a pre-HDFS major here at the University of North Carolina. I'm currently enrolled in Education 181, and in the future, I hope to work with kids in various settings and from various contexts to help them meet their developmental milestones. So therefore, today I chose to talk about two developmental theories that we have learned within the context of HDFS. Let's get started. Today, we will be diving into two developmental theories within the context of human development and family science. The two theories I am focusing on are behaviorism and cognitive developmental theory. So first, we're going to talk about behaviorism. Behaviorism is the theory that behavior is learned and can be boiled down to a stimulus-response association. It focuses on observable behavior that can be objectively measured. And it is often used as an explanation for normal and abnormal behavior in children. So, some of the key contributors of behaviorism are John Watson, Ivan Pavlov, and B.F. Skinner. Within behaviorism, we often talk about conditioning. Conditioning is seen as a method of behavior formation and alteration. So there are two types of conditioning. The first type is classical conditioning, which is the learning of behavior when it functions like a reflex. And the second type is operant conditioning, which is learning of behavior which increases or decreases in response to what precedes or follows. So within operant conditioning, reinforcement and punishment are essential. Reinforcement can be anything that encourages the child to do the desired behavior again. And punishment is the opposite. So anything that is going to discourage that child from repeating the behavior that they were punished for. So how do we use behaviorism in HDFS? HDFS can cover many things, from education to parenting to family life education. And so you see it in many different contexts. A few examples I have here are classroom management, potty training, and to teach principles when raising children. And in all of these cases, you would either reward or punish the child when it comes to certain behaviors so that they will repeat the desired behavior or so that they will not repeat the behavior that is not desired. So now let's look into an example of that. I've been really struggling with my potty training toddler lately. She tells me she needs to go to the potty, but she never actually follows through with the desired behavior.
Mommy, I have to pee on the potty.
Great, let's go to the potty. Sit on the potty.
I peed on the potty.
Yay, good job, you get a prize. 3 days later.
Mommy, I peed on the potty.
Yay, you get another prize. Another 3 days later.
Mommy, I peed on the potty.
Great, you get another prize. She doesn't know I'm classically conditioning her to potty on the toilet instead of in her diaper.
Wow, the classical conditioning really worked. I rewarded my toddler with small treats and toys when she performed the desired behavior in order to reward her and increase the likelihood that she would perform that desired behavior in the future. Second, we will be talking about cognitive developmental theory. So cognitive development theory was proposed by Jean Piaget, and it is the theory that learning and cognitive development happens in distinct stages. It focuses on qualitative and age-related stages. When coming up with this theory, Piaget wanted to focus on how children learn and respond to their surroundings. He believed his proposed stages were separate and universally experienced by all children, and he also characterized each stage based on how children understand the world in which they live, discover, and interact daily. So the stages that he proposed were sensory motor, which occurs from ages birth to 2 years old, in which the child learns through sensory practices. The next stage is the pre-operational stage, which occurs from ages 2 to 7, and that's the one I'm going to be diving into in my application later in the video. And this is when the child learns through imaginary play and starts to form some symbolic thought. Third stage is the concrete operational stage, which occurs between ages 7 and 11 years old. This is when your child starts to form some logical thinking and the beginning of abstract thought and thinking beyond themselves. And lastly, we have the formal operational stage, which is from ages 11 and beyond. And this is when your child is really set in that deeper thinking and reflection on how the world works. And they really think similarly to kind of how they will as adults because they have this deeper thinking and understanding. So, how do we use cognitive development in HDFS? Like I mentioned before, HDFS can be seen in various settings. Here I have 3 examples to how we can see it in those various settings. So, number 1, you can assess, you use cognitive development to assess if students are at the age appropriate level of learning, attention, language use, creativity, and reasoning. This is often done through testing within schools. And so you'll give a child a test with material that they should know at the age that they are at, and you see where they fall. And that will let you know if they're on track with Piaget's cognitive development stages, or if they're falling behind, or if they're a little ahead. Next, you can use it to encourage kids in various types of therapies to explore their abilities and environments. So in my case, this one hits kind of close to home. In the future, I hope to do occupational therapy. And so I could use cognitive development to assess my patients and see where they should be and where they are not falling within those stages. And I can use that, and then I would encourage different play and different exploration so that they can work on the abilities that they are behind in, and so they can explore the environment around them to have a better understanding. And lastly, we can use cognitive development to inform proper language use by caregivers, health providers, and educators. I think this is extremely, extremely important because school and the doctor's office is often a scary place for kids, especially when they don't understand what's going on. So when you really look into what their brain is like and how they think in their specific cognitive development stage, it really informs the type of language you can use and kind of brings you back down on their level so that you're communicating with them effectively and making them feel safe and heard and making sure that they understand. And now I'm going to get into my application of that theory.
I wonder what my 5-year-old's thinking about. What are you playing, honey?
I'm playing shopping. This is the cashier. His name is Long Dog Silver. This is Bucella. She's shopping at the shopping store. And this is the mean boss of Long Dog Silver. Long Dog Silver is checking out all the items. This is Cheerios. Beep. This is apples. Beep, 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 beep. This is Dr. Pepper. Beep, beep. Your total is $1 million. I don't have $1 million. And the mean manager comes along and says, you have to work at the store because you can't pay. So now Bucella's with Long Dog Silver and they're just checking things out all day.
Look at my 5-year-old. She's in her pre-operational stage. So she's using imaginary play to simulate and learn about the world around her. She has some symbolic thought, but she doesn't quite get the logic of how things really work, but she's so smart.
So thank you so much for taking the time to watch my video. These are my resources that I used. One for behaviorism and one for cognitive development. They were both found through the UNC libraries, and there are links within this slide, which I can share with you if you would like.